My name is Paula Montgomery. I am a member of the commission representing Maryland Department of the Environment. I would like to welcome everyone to the December meeting 2023 for the Lead Poisoning Prevention Commission of Maryland. I believe the first thing on our agenda is an approval of the minutes. Wendy, if you could pull those up, please. Any edits, suggestions, comments from our commission members?
Paula?
Yes.
Good morning. I'm in the MDE conference room. I thought so.
Okay.
So I'm gonna report from here, I guess.
Okay.
Sorry. Is anyone coming down here to join?
No. We had sent an email out earlier this week that we were going to do it virtually.
Okay, I must have missed that, and I apologize for that. Have we started recording?
Yes.
Okay. Well, good morning, everyone, and welcome. We have a full agenda today, and we're going to get right to that. And I don't know, Wendy, have we done the attendance, the public attendance?
So we have 1, 2, 3, 4, 5, 6. We haven't gone through the commissioners. So if we can just go through the commissioners, and so we can introduce yourself and where you're from, that would be great.
And make sure we have quorum. Do you want to just go down the list, Wendy, and we can do it that way?
Okay, sure. Feel free to either respond or raise your hand, either way. Adam Skolnick, I believe, is here. Anna Davis, Barbara Moore.
Good morning.
Benita Cooper.
Good morning.
Christina Poosh. I don't think she's here. Cliff Mitchell.
Myself, guys.
Thalia Attar. Jack Daniels.
I am here. Point of clarification, just so I know that I just stay in the acting role. Have we heard anything?
No, I'm sorry.
No,
I am on.
I mean, it's more inquisitive for me just to know.
Yeah, no,
so.
I keep checking
That's
with
fine.
the governor's office, and they are still in the process of review. So we don't have anything official yet.
Okay. Sorry.
I'll be sure to let everybody know.
Okay.
Jacob Benzikin. Jill Carter. Angela Paul. I did not see her. And Mary Beth Haller. Paul Rogers.
I'm here, American Academy of Pediatrics, Maryland chapter.
I think Nicole Hart is the actual representative, Wendy, for the city of Baltimore. Is that right?
No, not officially, not yet.
Okay,
It hasn't been approved.
All right.
Yep.
Thank you.
Paula Montgomery.
I'm here.
Ruth Ann Norton.
Thank you.
And Susan Kleinhammer, which I believe is on the phone. And she's muted, so
Okay.
yeah.
All right. Well, thank you. And let's get.
I apologize. I was running late. My apologies. It's Adam Skolnick.
Good morning, Adam. Welcome. Wendy, if we could put the agenda up and for the commission members, if we could get a motion to adopt the minutes, please.
I make a motion to adopt the minutes.
Great. Can I get a second or on that?
I second.
Okay. Before we go to vote, were there any comments or emendations to the minutes from the last meeting, please?
I think we didn't we already motion? Yeah, we motioned to approve them, Ruth Ann. I don't think there were any changes.
Okay, great. All in favor?
Aye.
Aye.
All
Aye.
opposed? All right, minutes have been approved. So we have a very packed agenda, and I know we've asked some very important and busy people to do some quick updates on areas of interest to the commission. And if you've got the agenda, Wendy, I think that we're going to have Deputy Secretary of Housing Community Development, Robin Chaconis, to talk to us. I can't to talk to us about the Green and Healthy Homes Task Force, and really appreciate Robin's leadership and the work of Nicola Tran on this. So thank you, Robin, for taking time. If you could update the commission on this whole House approach that the state is taking.
Good morning. Thank you, Ruth Ann. Can everyone hear me? Can someone just give me a
Yes.
thumbs up that I'm
Yep.
good? Okay,
You're
perfect.
good.
Okay, so I'm Robin Chaconis. I'm a deputy director at DHCD.
Hold on, Carla. Hold on.
I work for our Community Development Administration. I oversee our housing programs and also our small business lending. But my other job is as a deputy chair of the newly formed Green and Healthy Task Force. And so that's what I've been asked to come and talk to you and brief you on. And so I'll just spend the next few minutes giving you an overview of the task force and what we're working on. I'll keep it pretty high level and a summary. And if there's any questions or follow-up afterwards, I'm more than happy to dive into it. So I am the deputy chair of the task force. I serve with Secretary Day. He is the chair. And so the task force was created back in the 2023 session. It was part of a bill that was introduced from Delegate Charcudian, House Bill 169, which was titled Public Utilities, Energy Efficiency and Conservation Programs, Energy Performance Targets, and Low-Income Housing. And so what did that bill do? It basically did three things. It created some additional energy savings targets for the years 2024, 2025, and 2026, specifically for low-income households for the state. It also required some programmatic changes to the Empower program. If you're not familiar with the Empower program, it is a program that is run by DHCD to provide energy efficiency improvements in multifamily properties and for homeowners, specifically low income across the state. So that bill made some programmatic changes to how the department will have to run the program as these energy savings goals keep moving forward and advancing. And the third thing that the bill did was create the Green and Healthy Task Force. And so what that task force is required to do basically comes down to 3 or 4 categories. The task force is going to work together to advance the alignment, the branding, the coordination of resources to make the delivery of energy efficiency more efficient to low-income households. So that's one of the charges. One of the other things that the task force is going to have to do is keep track of existing resources and also new resources that are coming into the state that can help the state meet these goals. And that's a pretty big task. We have a lot of existing resources that are very directly tied to that purpose. We have probably a dozen or so right now that we know of that can be looked at to maybe tweak or change so that it can also help address energy efficiency. And then there's going to be some federal resources coming through from the IIJA and the IRA specifically that are going to be focused on energy efficiency and climate goals. Another charge of the task force is to examine barriers and to figure out policy recommendations that can be made to help low-income households achieve healthier green housing and affordability. And so the task force will start working on that soon as well. A fourth thing that the task force is going to be doing is engaging with stakeholders, policy folks, interested parties to really figure out how we can advance these goals. So not only for the task force to do this work, but to go out and work with other members of our community, stakeholders, nonprofits, to really hear what's working, what's not working, and figure out how to advance the mission. The task force is going to work together for 3 years. It's a 3-year charge. So we'll meet quarterly for the next couple of years to do all of these things. And then lastly, we have a bunch of reporting requirements along the way. And so we have our first one coming up in December. We'll be putting that out on the website shortly. That first report really is a progress report by the task force. Just looking at existing resources. What do we actually have in the state right now that's working towards these goals? Do we have a handle on all of them? Do we know exactly how they work? And then also, what do we know in the short term is coming through from federal resources? The task force has about 15 members right now. We have representation from the General Assembly, from the nonprofit sector, the advocacy groups, state agencies, and then we also have some private sector members that are representing contractors and also the affordable housing development community. We began meeting in August. We jump-started the task force. We've met monthly, August, September, October, November, just to kind of get everybody together, start looking at resources, looking at programs that are working, identifying the scope of what we think the problem or the cost will be to help and address low-income households, and then also to satisfy the first reporting requirement, which is going to be in December. I'm sorry, which is this month in December. I think that one of the important things and the takeaway right now, especially for you all, is that one of the things that the bill does, and in addition to energy efficiency, is really require all of us to start looking at energy efficiency and these goals through the lens of a whole home concept. So it's not just about going into a home and fixing up energy efficiency improvements. It is, how do we do the critical home repairs that are going to be necessary before you can get to energy efficiency? And so that's one of the things that the task force is going to be required to look at. It's one of the things that DHCD, in tandem with the Department of Budget and Management, will have to look at is, how do we create this whole home concept, and where are the fund sources that are going to allow us to go into homes, deal with the critical repairs, and that's going to include things like, addressing lead and other home repairs, and then we can go in and do the energy efficiency. I'll just end with the task force is about to submit its first report. All of this information is available on our website. We have a website in the DHCD space for the task force. It has all of our meetings, all of the dates that are coming up. They are public. We record them. All of this information is available on our website. Our next meeting will be, I think it's mid-January. I don't remember the date off the top of my head, but and so I'll end there. I'll take any questions or fill in any other comments that you might have on the task force.
Robin, thank you so much. And I again want to just commend you, Secretary Day and Nicola Trent, for the great work that you've done here. I don't know if there are comments or questions from anyone. I just also want to note, I serve on this task force, as does Dr. Mitchell from this commission. And one of the important things between MDE and DHCD that's going to be critically important, as dollars start to flow on the tripling of the weatherization budget under the Infrastructure Act and the greenhouse gas emission dollars that are coming under the Inflation Reduction Act, there will be an enormous amount of lead-based paint disturbed through these housing interventions to improve energy efficiency, climate, and also from the Charkoudian bill, there's going to be a lot of effort targeted to low-income, older housing. And so I think it's certainly important as a strategic partner that this commission and MDE be thinking about how to support the efforts of DHCD and the whole home approach on what we may be facing in terms of this disturbance of lead-based paint. And I really appreciate the ability to have a avenue which we can think holistically here. Wendy, do we have any questions from anyone for the deputy?
No, there's no hand raised and there's nothing in the chat, so we're good.
Well, Robin, we will let you, I know you've got a busy schedule. Please, you're welcome to stay. It's so gracious of you to give us your time this morning, and we look forward to continue working with you. Thank you for the public report on that.
Thank you, Ruth Ann, and thank you for the invitation.
All righty, thank you. Wendy, I think we have a guest from the EPA, if they are on the line, to discuss the national update on the Get the Lead Out campaign and the new release of the lead and copper proposal from EPA. Do we have somebody from Region 3 on the line here?
Yes, hi, good morning. This is Bill Richardson. I'm EPA Region 3. I'm in the Water Division. I'm the Drinking Water Section Chief. And I do have slides. Okay, there we go. I can.
That would be great. Thank you, Bill, for joining us today.
No problem. Thank you.
We love Region 3.
Thank you for having me. Just give me a second and I will get my slides shared for you all. So as Ruth Ann mentioned, I'm going to be talking a little bit about, hopefully you can all see my screen. And here we go. It's a little slow on my end.
You're good.
Okay, great. So I'm going to be talking about the Get the Lead Out Community Assistance Center that was recently announced by EPA, and also the recently announced proposed lead and copper rule improvements. So first, I'm going to talk a little bit about some of the lead service line technical assistance that EPA has been providing. We have two ongoing efforts, and these are EPA's technical assistance initiatives. We're really trying to focus on providing help to underserved communities by providing direct technical assistance to water systems in collaboration with the states. And the main goal is to really accelerate lead service line replacement. But, as many of you probably know, the first step in replacing a lead service line is actually, we need to know where they are. There's not a lot of great information on the actual location of where all the lead service lines are. So for the last year or so, we've been working on what we've been calling the lead service line replacement accelerators. We've been working with 4 states. Pennsylvania is the only Region 3 state that's been part of this, but we've been working with these 4 states, providing direct technical assistance to 10 communities in each state to help support them do their service line inventories. And the GLOW Center, the Get the Lead Out Center, was recently announced to try to build upon some of the successes that we've been seeing in the accelerator project. And we have resources available to support 200 additional communities nationwide. I know that there are many more water systems across the country, than 200, but we're, really, using the little bit of resources we have to try to support the water systems, and support our state partners who are already doing a lot of this work. So I'm going to just talk a little quickly about some of the high level goals of the GLOW Center, and what EPA is trying to accomplish. And the first is really that, as I mentioned, that direct technical assistance to communities, whether they need help developing their inventory, engaging with their community, or if they're at the point of getting started on replacing, whether that's a plan for replacement or working through an SRF process to get funding. So not every community will need the same level of support. So, the EPA with our contractors will be, just providing whatever support the community that, is participating in the GLOW, providing the support that they need to help expedite this work as quickly as possible. And the second one is to, build state capacity. EPA, we work very closely with the state primacy agencies. The state primacy agencies, they're the ones who are really on the forefront of working with the drinking water systems, in implementing the Safe Drinking Water Act. So we want to share any information or knowledge that we learn, through both the accelerators and the GLOW work, share that information with the states, since they're the ones who are really, they're the ones with boots on the ground who are really providing, support, to the water systems. And then finally, the last one is to share some of the same lessons learned, nationally. And that's more targeting some of the, the utilities, sharing information with utilities, who aren't able to get any of the EPA technical assistance or any of the technical assistance, that's been offered through the various state programs. Share some of that information, across the country, so water systems who are struggling, have some resources to help, to help them make progress as well. And then this is just a very high level overview of the process. A community will be selected. We actually haven't started yet selecting communities, but once a community is selected, we have a kickoff meeting, with the community, with the water system, to go over the process, the project, what the expectations are. And then, then after that kickoff meeting, we'll work with the water system to actually do a needs assessment. We have through the accelerators, we have essentially checklists that have been developed, that we could go through. Like, these are all the things that are needed to complete an inventory. These are all the tasks associated with it, and just try to get an idea of, what the water system might need support with. And then we'll use that needs assessment to develop a work plan that will be shared with the water system. So they almost have, a plan of the steps they need to take to complete their inventory. And then finally, where they might need additional assistance, where the water system, where the community might need additional assistance while implementing that work plan, the EPA contractors will be available for that. So there are a couple ways for, communities to be identified and selected to be part of the GLOW assistance. So there are, communities out there now that, based on their lead sampling efforts, that that are already, we're already aware that they do have some elevated lead levels in their drinking water. So that is one data source that we're going to be using. States can also self-identify. Communities or water systems can self-identify. We have a water TA request form on our websites where communities can, request direct assistance from EPA. And I think one of the big things for us is coordinating with the states. I know especially MDE has a lot of support that they're providing to water systems. So we want to make sure we're coordinating with the water supply program at MDE to make sure we're not duplicating efforts, anything that the state is doing, and just make sure the state, nationwide, that state primacy agencies are aware of what efforts EPA is doing, just so they're in the loop with what we're doing with water systems in your state. EPA is, we're ultimately responsible for, identifying the community and working directly with the community. We'll keep the states involved in the process as much as they want to, but realizing that, there's a lot of work going on in the state drinking water programs. We just, we want to, most of the responsibility for implementing this program is going to be on EPA, and the state primacy agencies can be involved however they feel that they want to be. And then we do have some priorities for the communities that we're looking to work with. One is community need. We're really trying to focus on those communities that need the help. That whether it's whether they're underfunded, understaffed. I know there's a plethora of those types of communities out there. But we really want to try to help communities that really need it. We want to try to work with communities that that they have a strong likelihood of having lead service lines. I think in our part of the country, there's definitely no shortage of those with the old houses that we have, here in Region 3 and in Maryland. And then, we want to work with communities that are just, open to working with EPA and our contractor, and trying to make progress, on identifying lead service lines and ultimately replacing them. So now I'm going to shift gears quickly, and I only have 3 more slides, and I'm happy to answer questions. But I wanted to shift gears quickly on the lead and copper rule improvements that were announced last week. So EPA announced the National Primary Drinking Water Regulation update for how lead is regulated in drinking water, and this builds upon several previous versions of the lead and copper rule. And with all the lead and copper rule work that EPA is doing, we're really looking to protect children and adults from lead exposure through drinking water. And, we're trying to base things upon science, and the existing practices that are already going on, at the drinking water systems across the country. And I highlighted some of the key provisions that are in the new lead and copper rule improvements to share with you all. And the biggest goal is that, EPA is proposing. So I should maybe, before I get into that, just say that this is just a proposed rule. So this is a proposed rule that is going out for public comment. This isn't a final rule, so none of these provisions are currently required, but these are things that EPA is proposing to add to our Safe Drinking Water Act regulations. So the first provision is to achieve replacement of 100% of lead service lines across the country within 10 years. I think EPA understands that that's a heavy lift for water systems and communities, but I think, we also understand it's, a key way to reduce lead exposure to people through drinking water. Another thing is just the locating of legacy pipes. So under the previous version of the lead and copper rule, the lead and copper rule revisions, water systems are required to provide an inventory of their service lines to the state primacy agency by October of 2024. So most of the water systems out there are, currently working on that. That's where a lot of EPA's technical assistance efforts are focused, and a lot of states are also working to support small water systems get that work completed. But under the LCRI, one of the things that EPA is proposing is to require the water systems to continually update their inventories as they learn more information. If they discover a pipe that they thought was copper is really lead, like to continue updating that service line inventory and making that available to the public. So making things as transparent as possible, making that information available to the public. And then also, to piggyback on the goal to achieve replacement of lead service lines, there's also a provision to create a plan. Each water system, we want them to create a plan that's going to be made publicly available for how they're going to achieve lead service line replacement in their community. Another improvement that we're looking to change in the lead and copper rule is how tap sampling is completed. So currently, and many of you all are probably aware of this, lead samples are collected in customers' homes right now, and it's a first draw 1 liter sample. There's been at least one state in the US that's been regulating lead with a 1st and 5th liter sample. Some of their data has shown that the 5th liter sample is more representative of water that might be sitting in a lead service line. So sometimes that 5th liter sample is higher in lead than a 1st liter sample is. Sometimes that 1st liter sample might only capture potential lead exposure through, a faucet or the plumbing behind a faucet. So moving forward, once the provisions, assuming, the provisions are promulgated as final as they were, in the draft, EPA would be regulating compliance with the lead and copper rule with the higher of those 2 samples. So we're really trying to target those worst case conditions for lead in drinking water. Another big one is the current action level for regulating lead is 15 parts per billion. EPA is proposing to lower that to 10 parts per billion. And then finally, we're looking at trying to strengthen some of the additional protections to lead exposure with water systems that have multiple lead action level exceedances, changing the requirements for the amount, the public notification, the education materials that they need to provide to customers to provide them information about the dangers that lead pose through drinking water. And a new provision that is being proposed is that when there are systems that have multiple exceedances of that lead action level, water systems will be required to provide filters for their customers, for the customers to use to reduce lead levels in their home. And then this is my last slide on next steps. So just yesterday, the lead and copper rule improvements were published in the Federal Register. So that is open for a 60-day public comment period. So that anyone and any members of the public can provide comments on that. EPA did hold an informational webinar yesterday about the proposed rule. There's a and I can share these. I'm happy to share these slides if there's an interest, because there's the first website there. The webinar was recorded, so that will be posted hopefully sometime next week. So if there's interest, folks can go back and listen to that. They probably get a lot more detail on the rule than I provided today. And then we're also holding a public hearing early next year on January 16th. So EPA's goal with the rules, our goal is to finalize the lead and copper rule improvements by October of 2024. So, once this public comment period concludes, our goal is to try to have that done by October of next year. And then, with all Safe Drinking Water Act regulations, there's usually a time period. There's usually a time period before the rule goes into effect. So the LCRI in the proposed rule would have a 3-year. It wouldn't become into effect until 2027. So just to give you an idea of like when the rules would actually become a requirement for water systems. So that is what I have for you all today. I'm happy to answer whatever questions I can. Sure, go ahead, Ruth.
Bill, thank you. First of all, how really thorough on that. I've got a couple of just simple questions. One, it's okay if if websites want to link to the EPA recording so that communities we reach, I assume that will work.
Yes.
But, and I know Maryland, I think we had an announcement, somebody will correct me if I'm wrong, but was it 240 million going to the state of Maryland from EPA, or it was a rather huge amount on water that we just saw. But my main question is on this, the testing, first of all, the first and fifth, really important, and what an interesting fact to learn, I think, for people, that you can't just trust just the first draw alone. But what was EPA's rationale to only go to 10 and not follow some of the states who have gone to 5 or are moving to lower levels in various pieces of legislation?
Yeah, and Ruth, to be totally, I'm probably not the best person to answer that. I wasn't intimately involved in the rule development process, and that's probably a question that's better suited for folks at EPA headquarters who were part of the the team who were part of the team looking at the information to make that determination. I apologize.
Yeah, no worries. I anticipate it will be probably the biggest thing from the health or advocacy community
Yes.
in the virtual public hearing to debate. And I just did not know if there was some thought about that. And on the GLOW technical assistance, right? And are there communities in Maryland in particular that rise up to the level of need that you are aware of?
Yeah, so we've had conversations with the water supply program at MDE about potentially, and I'll be honest, the folks at MDE understand the community needs, better than we do in Philadelphia. So we're really, trying to work with, the folks at MDE on, trying to help us do that identification on these are the folks that we're not reaching with our technical assistance that could use EPA support. So we're still in the process of having those conversations with folks in the water supply program.
Yeah. Hey, Tyler, if you're on, is there anything MDE would like to say about this? Anything that's been presented?
Sure. Just a brief update from our side too. We've already begun providing communities with technical assistance and funding for technical assistance in surveying. We are working with the Rural Water Association so that we can have even a larger stretch because some of those communities don't have the same kind of personnel as we do in our rural areas. And we've already committed $80 million in funding from BIL to support water systems in their inventory and the replacement work. And then over the next few years, we're going to continue adding more money to this. So, it's a great effort and we look forward to continuing all the work. And I certainly appreciate the assistance at EPA so that we're able to do this.
Yeah. Thanks, Tyler, for mentioning that. I was, totally missed the fact, I should mention, and I'm sure everyone's aware, like there is a significant amount of funding available to states right now, to support this effort. So I appreciate, Tyler, the work, that you're doing, to help, I think to help those, water systems, especially in the small communities where, they really need the support, to make these advancements and figuring out where their lead service lines are and, planning to, figuring out a way to, replace them in the future.
I can't take credit for this work. I worked on it when I was in my previous role, but our water supply program is doing great work in the water program.
Yeah, I agree.
Yeah.
Well, I want to also commend the city of Baltimore, who has put out a really tremendous effort through their website, their mapping tool for citizens, and dollars that they're putting forth, but teaching citizens some very basic, how do you figure out if your lines have lead by the scratch test. So I encourage people to go on to, and maybe Wendy, we can share those resources out of the DPW website in the city of Baltimore. I know we have now incorporated that when we go into houses, we're working with families to do the scratch test to identify lead service lines and to be able to tap resources to get service lines inside the or pipes inside the home replaced as well. I also want to point out I was very happy to hear Deacon Fox that we're going to make sure that there's no partial line replacement, so we're not breaking lines apart and causing lead to leach that otherwise wouldn't. Very smart, very thoughtful, and really good work. There was quite a big event to launch GLOW at the EPA, and then the great efforts around the lead and copper. I do encourage people who have an interest in this to participate in the January 16th virtual town halls and to provide feedback. Do you know the last day for public written comments, Bill? We will share those if you don't have them handy.
I remember reading it this morning and I can't remember. I just clicked on the link in my slides to figure it out. It's 60 days from yesterday.
Well, there you go. Somewhere around February, just say, right? So thank you. Wendy, do we have any questions from anyone?
No hands raised. There is in the comment a link. So for those who are unaware, there is a link there. I think that's from the EPA. So if you wanted to check that out, that will also be included in the minutes as an FYI too, in case you miss it.
Alrighty. Well, thank you.
Yeah, you're right. Just the date. I'm sorry, Ruth. I didn't mean to interrupt you. The comment period ends on February 5th.
February 5th. That makes sense. And thank you, Bill. Again, Region 3 is such a great office in the EPA and really appreciate that. And also the launch, which we don't have, and we're going to, in a future meeting, have the EPA Tic Tac Center to come and talk with us. The Environmental Protection Agency has put out a technical assistance center for communities around a number of environmental issues, including lead, and it is co-led by the University of Maryland here in Region 3, and Morgan State is an integral player as well. So we're going to invite them in a future meeting to come and talk about the tech centers. We're waiting until the $50 million grant program is announced for communities and couple that, but really appreciate an agency that went from 10 billion up to hundreds of billions of dollars under federal law. Probably not the same scaling in personnel, and just a lot of kudos to Heather Waller. So thank you.
Yeah, thank you for having me.
Appreciate it. Wendy, what is next on our agenda is a quick update. We're not going to be talking about the commission representation from the legislature. That will be tabled. Thought that had.
Do you have the secretary meeting update that you had?
About to get that. That's what we're getting to. And I'm going to combine that with the greenhouse gas because it's one and the same. I was very happy to meet Tyler. Can't get enough time on his schedule. So, Secretary McElwain and Suzanne Dorsey, Tyler Abbott met with us at GHHI to discuss a number of issues. One, our recent concerns over the high lead levels that we're seeing, and making sure that there is sufficient capacity, funding, and support for the MDE staff to ensure that we can address these issues as people are now more active coming out of COVID, more construction and rehab work that's exposing hazards, and also the period of time that we weren't able to keep pace on protection standards. We've seen some high lead levels. It has put a call to action on our local health departments, housing departments. Mount Washington has been an outstanding partner in this, but as Barbara knows, our goal is to put her and many of us out of business if we do this right. Really appreciate the Secretary's time. One of the things we did talk about and wanted to bring to MDE's attention is something I said earlier when Robin was on the phone from DHCD, which is we do have a calculated concern here that through all of the wonderful funding and programs and efforts, whether it's replacing pipes or doing weatherization or decarbonization, electrification in housing stock, and making more efforts to weatherize through the power funds as well, that we anticipate that there will be a greater need for oversight and enforcement and support for owners and contractors through on the disturbance of lead-based paint to a level that we may not have seen in a while. And I'm hopeful this commission and organizations like GHHI and MDE can work to monitor this and have a strategy around that. The importance of the MDE staff in all of this could not be higher. The other thing that we wanted to bring to state's attention, our efforts to do a coalition proposal. Hold on, I think we're changing here, so hang on one second. Okay, I think we have changed.
Wendy needs to unmute us. She's unmuted.
Oh, and I just went offline. Thank you over there.
We can hear you now.
Hi, Stephanie. Or Ruth
Can you
Ann,
hear
I
us?
don't know if you can hear us. Can you hear us?
All right, Wendy's talking. We can't.
Wendy,
We
I
can
think
hear
you
you guys.
need to unmute us.
Can you hear us?
We can hear you. Can you hear us?
Okay.
Yes, we
So
can hear you.
the microphone system is not set up and the quality has dropped. So I don't know, Ruth Ann, if you want to, if it's better for you to get on the phone.
Yes, and you just, I guess, put that on.
We have a, it's a very, very low voice that you have.
All right, well, thank you for the team here who was trying to do that. Anyhow, there is a substantial proposal that should be going in from states around what is called the Climate Pollution Reduction Grant. And the opportunity that exists for lead through that is through coalition proposals of states that are going in around healthy housing and lead as pre-weatherization mechanisms. It can result in fairly substantial money. Some of the monies available are into the hundreds of millions of dollars. And we were urging Maryland to join the effort through other states that GHHI, NASCOM, and ACEEE are working on to do a coalition proposal around healthy housing and lead, because one of the things that has not kept pace in the budgets federally is the money for lead, and the money that comes out of the Office of Healthy Housing is excellent money, but is highly restrictive and less able to be flexible with other programs. We think this will be a big opportunity if Maryland agrees to join with the other states of Michigan, Pennsylvania, New Jersey, Delaware, and DC, all of whom are on the same grid. It's called PJM. And so it is a pathway to get substantial funding for lead into areas throughout the state. And we're hopeful DHCD, MDE will work together to join that. And then the rest of the discussion that we had was really around climate efforts and decarbonization efforts. And so that was Tyler. I don't know if there was anything else we did discuss except for a potential opportunity for MDE to do a public offering to support legal services that may or may not be coming out of the department in the future. But we think there is a great need for legal services to support families through this. But Tyler, I don't know if there's anything else to report out of that meeting. I will say I found the secretary highly receptive to efforts to advance lead reduction.
No, I think you covered most of the things that we talked about. I think that the approach is pretty innovative, so we certainly appreciate you bringing that to the table, and look forward to working with you and DHCD on it so that we can make progress.
Yep. So I think this proposal is due in March or April, I think, and we'll keep the commission up to speed. Our goal is to get as much flexible money, whether it's through the Children's Health Insurance Program, through climate reduction, and to support efforts by the state to go in next year or in current application for lead hazard control monies. That application is due at the beginning of January. Jack, is the state going to resubmit? Is Jack Daniels still on the line?
He is. Jack, you're muted.
I apologize. I started talking and didn't unmute. So
And you were brilliant when everything you said. Just please repeat it.
Absolutely brilliant. I probably will not be able to do it so eloquently. Anyway, so we have applied to the Healthy Homes production. We did receive notification that they will make a decision in January. So we're waiting to hear back from that response. And I have escalated the capacity building NOFO up to our executive management, and we're having discussions. They did extend that from the 4th to the 17th of January. So we're waiting to hear a response so that we can come together. And I have been in contact with Shanika too as a potential to partner with MDE. So it's mutually beneficial, obviously, to both of us. So we're sort of working through that, and I'll have an update once we hear from our executive management team.
And is there not a lead hazard control application open as well?
So there was one previously. We were advised a while back ago that we did not receive that one. There is another one that came through that it is through the lead hazard Office of Lead Hazard Control, but it's for older home modifications, and that one is been submitted for a pre-app. We were just received notification, I think, a couple of days ago. That is being sort of handled through our NR because they're utilizing the capable model. It is money out of lead hazard, but it's more for older adult home modifications, and we are submitting the final application for that through DHCD, but that is not run through CDA.
Yep, got it. Okay. Well, we'll stay tuned on the larger opportunities for lead hazard control, because that obviously is important. And thank you for that. So I know we've invited Nicole Hart to give us an update on DHCD, and I don't know is Nicole on the line with us?
I believe she is.
I am here.
Okay.
Well, friend, and thank you for being here, and we're excited to hear what's happening at DHCD.
Nicole, do you have any slides or anything?
I do.
Okay. Screen's all yours.
And wait a minute. Let me make sure this is still right. 1 minute. Give me 1 second. I actually don't think my slides are going to show because I am not in my office.
Is there a way you can email them to me real quick? I can pull them up for you.
I can. Hold on 1 second.
Okay. Yep.
Just to note, Catherine Taylor, who is the director, is actually out sick today, so she's not on the call, but her program manager, Miss Nakia Randall, is here with me as well.
Why don't we, Wendy, make a quick change while you get that moving, and let's move to Jonathan and come back to you, Nicole. So that way,
we're gonna have Fred Banks speak on that. Fred, are you there?
Yep, I'm here. You guys hear me okay?
Yep. Do you have any slides, Fred?
No, I sure don't. No. Good morning. So we have been in response to the 3.5s to 4.9s. We've been working with John closely and some of our other inspectors and other department heads to come up with strategies to meet the needs of the public. We've also been working with MDH and Dr. Mitchell's office, looking at, and he's working with me to finalize a letter to physicians, notifying them of the change in elevated blood level. That also will go out to health clinics, labs, notifying them of the change. We have a significant amount of missing data that we want them to help us kind of capture to make sure we have all the information needed to make a proper assessment of the prioritization of the cases and to encourage follow-ups for those 3.5 to see if those levels are going up and down based on the notification that we send to the parents on strategies they could do to possibly identify hazards in the home. We're also working with the local health departments to prioritize referrals, present strategies to even before some of the parents and families that they're working with to identify hazards in the home, i.e. the cinnamon applesauce, things that are going on in the public, make sure they're aware of everything that's going on as far as hazards in and around the home, to continue to follow up and monitor and creating a communication plan so that we're all speaking the same language, both on the case management side and on the environmental investigation side. We're updating our outgoing communications as far as our letters to kind of develop tiers for each threshold of elevated blood level to give parents that have that 3.5 to 4.9 a different timeline to expect to hear from us so that we can prioritize cases that are more critical. And internally, where John created a tiered approach for environmental investigation. So to begin with the assessment of potential cases, working with Dr. Boss's unit to make sure these are, I'm forgetting the term they use, but it's actual cases versus those that are capillary, venous, but it's confirmed cases is what they use. And then prioritizing those cases and utilizing all of our risk assessors across the entire program, even the ones in accreditation and oversight. So we have a significant amount of risk assessors that have bounced to different units around here. So we're going to use all of our risk assessors in John's unit, and as cases bump up, use our compliance and enforcement supervisors to actually do inspections. And then if we bump up to the next level, we'll start using our division chiefs, our risk assessors, and other units. So we think we have a solid plan. We know it's going to be a lot of work. Everybody's kind of on hands on deck, and we hope that the numbers start going down. But in case they don't, I think we're prepared. Of course, we're going to need resources, and we're looking at grants. We're looking at partnerships. We're throwing everything against the wall to see what it sticks. We just had a new inspector start yesterday, but it's going to be some time before she can actually go out and start doing risk assessments. So we're going to get it trained up as quickly and as efficient as possible. But we have a lot to do, and if we get in a pinch, we'll see if we can get Paul out there to do some inspections for us. So
he's tough.
Yeah.
Hey, Fred, has
ma'am.
there been a sort of an asset and gap analysis projection of what you anticipate in cases for the need for all of us to respond at 3.5, what that looks like in the landscape? Because this not only impacts MDE, it impacts places like the city of Baltimore, right, on its health and housing side, other jurisdictions, obviously, throughout the state. But do we have Now, as we go into legislative briefings, right? And do we have a projection of what might be needed here to actually really get much strongly, advancing prevention by the aggressive lowering of the levels by CDC and the state? Do we know and have what analysis is there and what's needed and what support do you need in that?
So there's a significant amount of factors that kind of go into what we projected. One, I think that's going to make a huge difference, which is a good thing. We think testing is going to increase significantly with the MSD rule of, children need to be tested before they go to start school or daycare. So unfortunately, we think with testing going up, some of those numbers are going to go up. And then with some of the other policies statewide, nationwide, we think there's going to be an identification of more kids that may be affected by lead and other means. And then we think with the publicity that the cinnamon applesauce is getting, and more parents might go get their kids tested as well. So we think with the increase of testing, we anticipate anywhere from a potential 1,500 to 800 additional new potential cases. I would say maybe about half of those may refuse to have us come into their homes, which is something that's unfortunate. So we're working on trying to be more community friendly, get out there so people see us as an asset. That's a good thing, but ultimately it's going to create more work for us. And so that, while we're anxious about getting to as many homes as possible, we got to make sure that we don't, burn our guys out. So I think that we're looking at maybe like $2.5 to $3 million that we would need to just get to where the policies are going. And then we start looking at what EPA is doing with those dust lead clearance levels, but we're kind of in the dark on how much that's going to affect us also. But we know there's going to be an impact, primarily secondarily with the labs and the secondary costs they're going to impose on us to do this specialized testing and things like that. But there's a lot out there.
I do want to bring the attention. I'm happy to talk with the department, but for all of everybody on the line here, there is also out at the EPA right now community change grants that are quite flexible, and we should look at whether or not this would be an opportunity for helping to support some of these efforts, right? And engagement that's necessary.
Yeah, we also looked at our epidemiologist is down in Atlanta now at the CDC meeting, and we're looking at some NIH grants, and we're trying to, we've been beating our heads against the wall to try to find a significant amount of alternative funding. But
well, don't beat your head against the wall, but let's beat all the dust out of the curtain. Yeah, right.
There you go.
Yeah, I got you.
And we're also working on different legislative efforts too. And so, although not for everyone just yet, I'll come down and talk to you here in a minute. Roseanne.
Yeah, and I'm, I think, we're quite supportive of the legislature needs to kick in. We may need to, we have to look at the different sources because it can't just be a one-time thing, right? As we are moving here, and we just, and as I said, I'm going to repeat this worry 1,000 times a Sunday, and it's a worry and an opportunity with all of the investment that we hope definitely delivers on its promise to get to low-income communities, to improve housing through the various federal funds. That's also a risk and opportunity to eradicate lead exposure, right? So I really appreciate that. Wendy, do we have other questions or comments for Fred?
Yeah, so Tiffany Price has some comments, actually 2 questions. The first is, the local, we have been asked about reporting the increased levels with the applesauce pouches. Does the commission recommend us to have them report all potential cases to the FDA? That's the first question. And the second, we have had our local MCOs offering $75 gift cards to have lead testing. They had an event that only did capillary testing done to get the gift card. How do we at a local level get those results? I have had 2 calls from parents not knowing what to do when the doctors did not have any results when we followed up.
So I can answer the first question. We met with the EPA last week, and it was
Yes.
I want to say it was a nationwide call. That they have a website set up where you can categorize your potential applesauce contaminations, and it's primary cause, secondary cause, potential cause, possible cause. And you can just go in and identify that. I don't have the link on me, but I'm pretty sure Dr. Mitchell was on that call. So I would check with him first, but if not, Tiffany, I'll email it out to you before the end of the day.
I think, Fred, let's get that it's a CPSC and FDA links, and we can get that, and maybe Wendy can send it out to everybody who's on this call. And it's not just, as I understand it, about the applesauce pouches, but about these food pouches in general, using the same material. But I am concerned on the effort to get kids tested is amazingly important. But really urging, and I hope that MDH will urge the managed care organizations and the healthcare organizations, where possible, to conduct venous tests and be able to do that. I know it's easier to kind of do the capillary, but as much as possible, setting that up and getting that engagement. But I'm glad to see they're doing the efforts there. But I think there's more to come on that, obviously, as we double down on trying to get to this 3.5 response. And again, numerous states are now going at the 3.5 level, and it does put a lot of stress and effort that it put on MDH and MDE. Going to be very important that this commission and members of the commission work together to advocate in the legislature for resources, as well as bring grant opportunities to support our locals and state here for certain. Wendy, do we have other questions?
No, there's no other questions, no hands raised, and Nicole,
Sorry.
wait.
Barbara.
Just following up with Tiffany's question, I know a while back it was discussed that all lead levels would be on Immunet as well. I just recently had 2 different health departments report to me that the lead results are not in Immunet. And I checked on some of our patients that I know we do venous, and they're not showing up on their child's Immunet screen either. So I'm not sure who, I think that's MDH that takes care of that. Because I was going to say that would be one place they could find results, but it's not working.
Tiffany, can you go back to your team and look at that, please? I see your hand is raised. Let's go to you first.
Yeah, so basically the calls that we got that it was done at local levels, Priority Partners, I guess, had held an event at our Goodwill Center, and they did capillary. So when we were calling, they told the parents what it was. So when we called the doctors to try to get some of those follow-ups, the doctors had no idea what was going on. And we're only going by what the parents are telling us that the capillary levels were. So I didn't know if those MCOs, like through the Medicaid program, if they were getting those results to send out, or if this was just an initiated program done by these MCOs to just get more lead testing done. So that was kind of my question. It was harder to rephrase that in chat.
Yeah, I think we probably should ask MDH to call Priority Partners, have a discussion, track that through. But also, I think Barbara's point on getting levels over to Immunet is something that will be very important, just in the communication pieces there. So if MDH could look at that and report back at the next meeting, or report back in the interim about getting the Immunet system up and running thoroughly, be really helpful.
Paula has her hand raised.
Yep, I see that. Paula.
Yes, thank you, everyone. A great discussion. Ruth Ann, I appreciate some of the comments that you've just made regarding resources and the follow-up of children with MCOs. I concur that it's something that MDH should consult with them. I'm wondering if it's just sort of like a voluntary kind of collection of information. One of the things I did want to, and Fred can piggyback on this, one of the things that we're going to plan on doing in the next upcoming year, is Dr. Balls, Victoria, and myself are going to be going out to health departments and either meeting with them, in person, however they want, or virtually, and sort of get a needs assessment regarding their needs for case management of children. As you all know, that we have HELPs, and we're integrating into HELPs currently right now. So the hope is that that could be a platform for case managers going forward. So I just wanted to touch on that a little bit.
Thank you for that. Dr. Rena Voss.
Good morning to each of you. I just also wanted to support how Dr. Banks was describing the communications that we're trying to make clear about the reporting of the applesauce risk factor, and that it is true. On the website, we are encouraging parents to report their complaint in regard to their defining those lots that went out in the information, in regard if they know that they have exposed their children in consumption of the applesauce, the cinnamon in particular. And we are encouraging them to get their children tested with their primary physician. And as Dr. Banks has indicated, a letter is being prepared to give additional clarification to physicians across the state in regard to their role and responsibilities for the follow-up. With their submission of their complaint, which is a formal complaint, it is indeed transferred to Maryland State MDH Food Protection Center. It is there where, if there is a sample pouch remaining available within the client who submitted the report and it was filed with FDA, which is collaborating directly with CDC, they will be contacted in order to collect a sample. That sample analysis is provided to MDE as well as CDC, as well as the physician. Definitely, we have had some cases formally submitted to the FDA that have went through the process. The data is ill-defined in regard to the exact number across the state. So this is an evolving and continuing investigation and assessment for treatment. The second component of Tiffany, in regard to incentives for testing, we have identified that there is the need for additional and more direct education regarding the capillary because some individuals are submitting capillary reports that indeed they are reporting as venous. So we are having to make that emphasis that capillary lab results is a screening. It is not a confirmatory value. If indeed it is elevated, that family and physician and property owner is indeed notified. But it is for tracking purposes. After the first, it will become the official reference level in Maryland. But to that time, we are only tracking the capillary elevations to ensure follow-up with a venous test. And I hope that that is helpful for clarification.
Indeed, thank you, and appreciate that. If we don't have anything further on that, except for that, I will encourage MDE to please put out media, potentially media notice on this, and I'm sure you're going to as this moves forward. But without any other questions, let's move to Nicole Hart.
Thank you.
All right, let me pull up the slides for everyone. Just let me know when to change them. Slideshow. Okay.
All right. Okay. All right. Thank you. Again, my name is Nicole Hart. I'm Deputy Commissioner of Home Ownership and Housing Preservation with Baltimore City Department of Housing and Community Development. So, and Catherine Taylor, who unfortunately isn't here today, is our Lead Hazard Reduction Program Director. So I'm here just to give you a brief update on where we stand with our lead program. Next slide, please. And of course, you already know, you're well versed in our purpose and what we do. So I won't read that slide. Next slide. And what services we are providing in addition to the temporary relocation while the work is being done. Next slide, please. So just the good part about our funding. So what we have right now with housing and urban development is our lead abatement grant that's from September 2019. The award was $4.1 million. To date, we've spent approximately 1.8 in lead interventions, and we have a balance of approximately 1.5 million. We also have the Healthy Home Supplement of the $600,000, and that balance is approximately $500,000. We also have in our toolkit money from Maryland Department of Housing and Community Development matching funds for lead interventions. That was 1.75 million, and our balance is approximately 1.3 million. We also have city matching funds for lead interventions of 2.5 million, and we have a balance of about 2 million in that pot. Next slide, please. And these numbers are as of June 2023. Units that we have completed and cleared on the lead abatement grant, 36. And we estimate for the next quarter, we will complete 24. And on the other lead hazard reduction grant, we completed 19 units, and we are estimating that we will complete 20 next quarter. Next slide. So just a little bit to talk about our challenges and then also our solutions. One of the main challenges was recovering from the COVID-19 pandemic. We did have a halt in services from the start of the grant until March 22, just due to all the parameters around COVID and prevention of COVID. Clients are hesitant to have staff and contractors in their homes. So we're still kind of working our way through that. It has gotten better, but it still continues to be a problem. And then staff turnover. I'm not sure about other agencies, but within the city of Baltimore, we have had staff turnover where, just in how people see their work. Many people want to work from home now, and there are a lot of virtual jobs. So we've lost a lot of employees, and this is just not in our lead department. This is just throughout the agency. Either other jurisdictions are more attractive, or the promise for stay at home work has been an issue for us. But we'll talk about some of our solutions when I get to that column. We had procurement delays, and it delayed the contractors' RFQ. And then as far as intake and enrollment, clients that we received during the pandemic have been put on hold due to the delay of unit production. And then also as another COVID challenge. Once we came out of COVID, we saw an increase in production costs and in hazards. So what we have is solutions. We had an extension granted by HUD on both grants to be able to meet our goals. We did start the unit production with the help of the emergency contract with the assistance of Commissioner Kennedy. We have expedited the hiring process to increase staff in our program. So we do have some new staff coming on board. So we're eager for them to come on board and get trained up so they can hit the ground running. We have begun utilizing all forms of e-communications to complete the intake process. We have an online portal for our applications where our clients can submit their documents directly to the portal. We've increased our outreach efforts by attending over 30 community events. We hosted 12 presentations for local community organizations, and we have utilized MEMA as well to reach out to other populations of people that would not traditionally apply for services.
Nicole, could you define MEMA for folks who may not know?
You're going to make me do that acronym.
Oh, no, that's okay. Don't worry about it. It's fine.
But MEMA is the, I can't remember the exact definition, but they help us with the language translations, and they help us with all of the other nationalities and populations to ensure that we have our data in multiple languages, that we have our outreach materials in multiple languages, and they also assist us with translation services.
Yeah, it's excellent, and so glad to see you using it.
Thank you, Felicia, Mayor's Office of Immigrant Affairs. I had a brain freeze. And so last but not least, we are utilizing the ARPA funds to address lead-based hazards and paint hazards and healthy home hazards. So in the past, when we've had cases that we couldn't move forward or we didn't have enough funds to be able to assist, we now have the ARPA funds at play that we are layering with our lead money as well to be able to complete as many cases as possible. I think that's the last slide, Wendy, but you can go to the, yep, that was the last slide.
First of all, the department is really doing such an excellent job under your leadership, and I want to just commend you on that.
Thank you.
And I want to say yesterday I had the opportunity to go out with the staff from the American Rescue Plan, the Mayor's Office of Recovery, and they have an entire outreach group and their field team, and how great they were, just so you're aware, on their interaction with our clients and also their knowledge around the need for families to enroll to get lead out of their houses. And I know you work with them, but boy, I think you have a really good partner in that. And I know we're going to try to utilize that mechanism as well at GHHI as partners to the city. But just want to thank you for that. Wendy, do we have questions for the city of Baltimore?
There are no questions.
Okay, well,
Wait, no,
Barbara
hold on.
Moore.
There's a
There you
hand.
go, Barbara.
What is, besides having an elevated lead level, what is the criteria for the families to be eligible for the services? Because we have a lot of
To be
children that
eligible for
receive-
our lead services, they need, well, for the federal month, for the HUD money, they need to have a child age 6 and under in the home. And even if they don't live in the home, they have to be in the house. Nakia, correct me if I'm wrong, 10 hours a week, or a pregnant woman.
Yes.
Okay.
So that's the caveat to use that lead money. Also, 80% or below AMI.
Okay.
Those are the two factors. But again, what I will say is that just by having the ARPA awards, it's if there is someone who doesn't fit in that box for the HUD money, for a lot of cases, we're able to do work outside of the HUD money now that we have all of that ARPA money unlocked. So we have a number of grants with ARPA. We have a HUBS grant that's for older adults. We were awarded $7 million for that. We were awarded $4 million for healthy homes with ARPA money. And then what will be coming on board soon is our wealth building to middle neighborhoods. What is unique about the wealth building to middle neighborhoods ARPA announcement is that these are traditional neighborhoods that most likely those families will be over 80% of AMI. And we've identified through the housing typology, you'll see this come out, it hasn't been released yet, but what you'll see is that they're neighborhoods that usually trend above 80% AMI that we'll be able to assist with some funds if they need lead remediation. So that will actually be a blessing and a groundbreaking for those targeted 5 neighborhoods that will be able to help with the wealth building money.
Okay, and then a referral will, if Baltimore City's already gone in and done an inspection, or MDE has gone into a city home and done an inspection, and it's identified as an issue and support is needed for the family, will they automatically make a referral to y'all, or from our clinic? I'm Barb Moore, I'm from Mount Washington Pediatrics Lead Poisoning Program, or should we just make the referral directly?
I'm going to defer to Nakia Randall, who's the program manager, to answer that specifically.
So traditionally, good morning, everyone. So traditionally, we can go through the lead program. I'm sorry, the light program, which will filter the referral down to us. Or on the last slide, Catherine Taylor, who's the program manager, her information was on the last slide, and we also can receive referrals that way. Or myself, Nakia.Randall@baltimorecity.gov. So those are different ways that we can receive referrals, or we can walk them in. We'll take them however we can get them.
Yep.
Okay, so an email from one of us would do the trick.
Yes. Yep.
Okay, thank you.
You're welcome.
And Barbara, we'll share that out with all commissioners, the different emails for referral to do that. In support of the city, GHHI also has $2.5 million to go directly to these cases as well. And I think if you make a referral one way or the other, there will work to who can get there fastest. And if there's high lead needs or that sort of work, I know we work pretty much like a team on that. And in support of this, but those are really extraordinary resources. Nicole, I have to say that slightly above 80% of median income, which is what the state's CHIP program between MDH and DHCD is trying to do, that will give some relief to them. If in Baltimore can take those cases and use those CHIP dollars in other places too. I think that's another way of helping to scale response here. So it's really great commendation on that. And I know you and Alice have fought for that. So congratulations on getting that heard, and to your staff on that. Other questions for the city? Fantastic. So I think we are now, Wendy, you wanted to talk about the commission reporting calendar.
Yeah, so if we can just briefly discuss if anybody wants to, and I pulled it up. So if anybody wants me to add anything. So for the January lineup, we're just going to be discussing the schedule for the 2024 year. You know, because usually we're taking off June, July, and August, I believe. So we'll just make sure, you know, if that schedule's still going, we'll get that either voted on or discussed. And then if anybody, you know, we'll also discuss if anybody wants to add anything. We'll talk about more of the reporting calendar. So every year we have to report to the governor's office what the commission is doing. So Paula or myself will kind of briefly go over that. We should probably make sure the legislation subcommittee, you know, who is on that, and kind of get that going. And then Camille Burke was supposed to be talking on the CDC grant, but she does have a replacement now. I don't have the person's name, so we'll figure that out. As far as January through the rest of the months, there are some slots.
Wendy, if I could stop you there, if you could please add the EPA Technical Assistance Center presentation to January. I would appreciate that.
Technical
Assistance Center.
Now, who would be presenting that?
That's the University of Maryland. It's Jacoby Wilson's group. I don't know who he's going to have present, but we'll try to find that out.
Okay.
And the new Baltimore City lead director is Julia. We just saw it go up. So
it's Julie DiGirolamo.
There you go.
Totally mispronouncing her name, but she starts next week.
Okay. Great. Well, welcome, Julie. And Margaret, can you just, when you guys when she is on board, if we could do an introductory email, it'd be so great.
Of course.
Thank you. Fantastic. Thank you, Margaret.
So anybody want to add anything else for the upcoming months? Like now would be the time to do that, or in January too. There are some things that we were going to put on that haven't been assigned a month yet. So these are things to think about. And yeah, so if anybody has any revisions or additions, just let me know in the comments, or we can put it on there now. Send me an email. But that's kind of our lineup for January so far.
Well, I think if you will circulate that, we'll ask for people's comments back to see if there'll be input on things that either you, to everyone's constituency, represents. It would be helpful to know, and what other kind of opportunities there might be. Wendy, as we get to the issue also of the meeting calendar, the only thing I want to ask the Commission and MDE to consider is that June is Healthy Homes Awareness Month. I think it's really good for people to understand civically where commissions can be helpful and engaged. I would really like the Commission to at least consider an optional public meeting somewhere in the state that we could do some planning both in June and October to get out of our virtual, or Stephanie and I in the conference room here, and into the public and do some planning. I know we did one foray into Henderson Hopkins School. We had some, but if we do some planning, we could get some pretty good public input, maybe some participation by parents and other things. And I would like us to consider that. I don't know how we might consider that. It would mean that we would add June to the calendar. I don't think people may be opposed to that. We'll certainly hear whether they are. But there are a lot of activities, and I think commissioners, it would be good for commissioners to be engaged and see and participate in these public activities that are often supported by groups. And I know MDE does a great job of, and MDH and others do a great job of participating in those. But I'd love to see some of the commissioners do that as well. So I don't know what the mechanism or avenue is for that. I also think we should look at potentially inviting the Consumer Product Safety Commission, or FDA, to give a brief presentation in either January or February as a public service on how people can more readily report on things that are not lead in paint or water or soil, right? But in the products issue that we hear about a lot. And that may also include the immigrant, the state office on immigrant affairs, if there's a way that we can talk about education efforts that are happening there. But are there other comments for Wendy from commissioners on anything that she has up here at this time?
No. Okay.
Okay.
I just want to add, I think it's a great idea to have a public meeting, certainly in October, and then if everyone's not opposed to June, figure out how to make that work too. But happy to work with you on that.
Yeah, I think, we kind of led as part of the Healthy Homes message, right? There isn't, and I may propose this to Robin too, as we have the Green and Healthy Homes Task Force over at DHCD, just an opportunity to work together. I know we did a joint kind of crossover with the Children's Environmental Health and the Commission and the Environmental Justice Commission. And I do want to also do what we did many, many years ago, was invite people from those commissions to come and present here, so we know where there might be crossover opportunities. And then Tyler, I was thinking about if MDE, with all the things that are happening around products, water, moving to 3.5, et cetera. I did notice there happens to be a reporter, I think it's at WBAL, who's particularly interested in all of the issues of lead. So I'm happy to share that with Jay.
Sure.
A guy named Tolly Taylor, who seems to be really focused on this. And I think this is good for the public, to have somebody in the media helping to share these messages. So
thank you.
All right. Wendy, I don't know, you have here, I guess, in the next meeting to vote on the calendar. Something, I guess we can do that at the next meeting, but I would like people to think about, I don't think it would be a bad idea if we held a commission meeting, for example, Barbara, sorry for this, but at Mount Washington Pediatric Hospital, where you treat children who are poisoned by lead, and have commissioners come in person and see the clinic and understand the work that Mount Washington does, and how important that work is. And that, but I would like to see that level of engagement. I think it's important to support the mission and the effort overall. I don't know if you'd be open to it.
Sure. We can't probably do it on a clinic day because that's really chaotic, but I can make arrangements for a conference room that we can be in, and we can do a hybrid if we need to.
Yeah.
And then tour the clinic.
Yep. It'd be great.
Okay.
Some things that we would consider. If nothing else, Wendy, I guess we can move to anyone who does have hot topics. We can move down the list. MDE, any other hot topics we didn't cover?
No, we certainly have a lot of hot topics right now, but they got touched on in every other part of this. Unless anybody has any questions for me.
Great. MDH, Dr. Mitchell, I think, is with the CDC. I'm not sure.
He's not on.
Yep. Paul, anything from the Academy?
No, nothing new to report at this point.
Okay. Mangela?
Mangela's not on. Yeah, Mangela's not on either.
That is a rare occasion. So going to make us worry. Benita Cooper, is she on?
Yes, she's
Yes,
on.
nothing. I don't have anything. Thank you.
All righty. DHCD, Jack, I think you've pretty thoroughly covered things, but anything else?
Yep, nothing additional at this time.
Okay, well, and Baltimore City, we heard from Department of Housing and Community Development. Thank you so much, Nicole, and team. Anything from the Health Department?
Nope, nothing to report. Thank you.
Okay, Margaret, thank you for standing in. I appreciate that. From a GHHI standpoint, I think we've talked about a lot of it, but just like the city, we have funding from, we just announced yesterday, additional funding from a congressional set aside to make houses lead safe, healthy, and energy efficient, as well as $2.5 million from Mayor Scott from the ARP money, and healthy housing money directly as well. If you have families, we should be able to get to them quickly. And if you have families to refer, please do refer them to us. And you can do that at info@ghhi.org directly to me, Wes Stewart, who's on the line. And Wes, let me ask you, are there other, I know we have some trainings and different things coming up for contractors and the public, but is there anything that you want to raise here?
Just want to let folks know we'll be supporting MDH on getting information out on the changing of the flood lead reference action levels to both healthcare providers and also parents, making sure people understand what those changes mean, the levels mean, effective January 2024. So we'll be helping MDH with that information campaign.
Fantastic. And please encourage people to check our website for events. We'll try to get those out. I know we will work with MDE, or I'll work with MDE to see if we can move along the nominations process with the governor's office. And I guess is there any other open public comment or updates to share from anyone on the line? Hearing none, we want to wish everyone a very happy holiday season, whatever you may celebrate or celebrate multiple ways. Please stay safe, warm, and healthy in December. We will see you back here in January. Appreciate the work that Wendy does to support the commission, and thank you very much, and see you in January.